for us to be able to get rid of the problem, we will need to understand what is the cause of inflammations. So one of the commonest cause of inflammations, which I did share a little bit just now, is untreated injury or untreated infections. Untreated injury, for example, if a diabetic patient having a small cut at the fingers, so under normal circumstances, we might be able to have direct healing. However, for diabetic patients, because the immune system is a little bit down, for the nutritional status is a little bit down, because of the diabetic conditions, the body conditions is also having delayed in wound healing. So what will happen? A simple cut eventually might become a chronic wound, which sometimes might even require amputations. And I think that is very horrible conditions. So its prevention is always better than cure. The questions that Sylvie asked us now is actually very important. Is sugar the source and the cause of inflammation? I would say yes. So if possible, try to reduce the intake of sugar, try to reduce the intake of carbohydrate. By doing so, we will make sure that our body is able to heal faster. For example, we always ask, why is there a craving for sugar? So when we learn about medicines, when we learn about hormone, so we notice that for patients who are having cortisol, which is the stress hormone deficiency, they will have this urge in craving for sugar and craving for salty diet. So if your daughter having this issue, question number one I would like to ask is having sugar and high carbs diet a common things or common practice at home? If it's a yes, then maybe you might want to change the way you serve the food to your family member, basically to a more healthy anti-inflammation diet plan. For example, more protein, more fibers, and then cut down the sugar. So if she's still longing basically for sugar, so what we need to do is we will just need to kind of like explain it to your daughter or explain it to patients that we can cut down sugar slowly, not abruptly, because the moment when we cut down the sugar abruptly, the urge and the craving, basically it will come even stronger. To identify the source of stress is also important. And then whenever the patient start eating, we will suggest the patients, why not you drink water first? Because sometimes they cannot differentiate whether the body is lacking of water, whether it's the thirst centers asking for help, or is it the satiety center asking for help. So usually I will get the patients basically to start drinking water first, warm water, before they start eating. So that will be able to reduce the intake of food. And then the type of food selection is also important. So if you do have questions about this, I would like you to maybe go back to the Facebook live session shared by Dr. William. So Dr. William did talk about gut microbiome, the different types of bacteria in our gastrointestinal tract, because in the gastrointestinal tract, basically there are trillions of bacteria. And then if you constantly feeding your daughter with high sugar, high carbohydrate diet, basically we are feeding this group of bacteria which consume more on sugar and carbohydrate. So the moment when you cut down the sugar that you serve your daughter, this group of bacteria basically will be activated, and then it will kind of like stimulate and then sensitize and then trigger your daughter to look for more sugar and carbs. The second commonest cause of chronic inflammation is autoimmune disorder. For example, like immune system which mistakenly attacking the healthy tissue. For example, SLE, hyperthyroid, and third the third common cause of chronic inflammations, basically we are talking about long-term exposure to irritants. For example, industrial chemical pollutions, polluted air, or cigarette smokes is also one of the commonest cause. Chronic stress is also one of the commonest cause of chronic inflammations. So emotional and physical stress, for example, if you are working under a constantly stressful environment, not getting enough sleep, what will happen is it will trigger high productions of cortisol in the body, which eventually will leading to high oxidative stress. Last but not least, we are talking about chronic inflammations which caused by hormone imbalance like menopause and andropause, adrenal system insufficiency, which I shared just now regarding the cortisol level in the body.